Hey, you're listening to Afternoons. It is 4 minutes past 3, and we are talking psychobabble now. I think it's fair to say that in recent years, terms like gaslighting, boundaries, and trauma have leapt from therapy rooms into our everyday speech, but they are, I would say, quite often misused and maybe misunderstood. Now, a recent Life Stance survey found nearly 30% of women and 25% of men say they regularly use therapy speak in daily conversations, which kind of underlines how widespread this has become. But are we using the terms correctly? Or if we're just throwing them around willy-nilly, are we actually pathologising really quite basic human behaviours? To get into it, I am joined this hour in studio by Dr. Thoraiya from Dubai's Human Relations Institute. And Dr. Hati, how are you?
I'm good. How are you?
I'm good, thank you. Thank you so much for coming in. To me, those figures sounded high. 30% of women, 25% of men. Are you surprised that many people are saying, yeah, I regularly used therapy language in my day-to-day conversations?
I would actually say it's probably much higher than that. Much higher. And I think a lot of people don't want to admit that they use these words in the way. And there are some words that they don't even realize that they're using in an incorrect manner as well.
Really?
I have to say one of my biggest pet peeves when I talk to people is when they use words very haphazardly. And these are very much clinical terms, and they're not terms to be used in everyday language. Terms like toxic, trauma, depression, anxiety, even narcissistic, psychopathic. That's one of my favorite ones where people are like, he's such a psychopath, and I'm like, actually, no, he's not even close. And so these types of terms, but then something a little bit less, let's say clinical, like boundaries, for instance, or gaslighting, or manipulation. These types of terms, they're used so incorrectly that now they're being weaponized against individuals that disagree with you, that maybe don't like what you're saying, maybe are trying to take care of you in a way that you don't want them to, for instance, parents. So I think these words have been taken not just out of context, but have been taken and are actually being used in the manner in which they are throwing them out.
And, you know, when everybody starts talking in these therapy terms, I would initially my instinct would be, well, this is good. This means that everyone is talking about their feelings. We've been saying for years, we all need to communicate more openly. Everybody's going to therapy.
I wish.
But actually, if everyone's using them wrong, it suggests they're not actually learning them directly from a therapist in a therapeutic setting.
Right. They're not. They're usually learning it from all the wrong channels. And one of the words I think that gives me a lot, like it irks me every time I hear it, is that people will say to me, I'm so self-aware and I'm so emotionally intelligent. And I'm like, well, if that were true, there are so many things that you would be doing differently. See, awareness, like self-awareness, for instance, is not about self-knowledge. Self-knowledge is important for sure, but that's only half the equation of self-awareness. Self-awareness involves change. It involves sitting comfortably or uncomfortably with your emotions and working through that and processing them. Or, for instance, any other type of word that is being used in a way, emotional intelligence, people think emotional intelligence means I can understand what other people feel. But that's not what emotional intelligence is. That's barely 1/5 of what emotional intelligence is. So I think a lot of these words that people are using, and I understand that it's not coming from a malicious place, but it's really coming from a place of ignorance and even a little bit of arrogance in the sense of, you know, if you really want to know what these words are, then give them the weight they deserve. Because when we use them in such a haphazard way, we're actually minimizing the experience of individuals that actually experience these things. So for instance, trauma. Trauma is a subjective experience. It's not something that I can say. I can have 5 people get into the same car accident, God forbid anybody does, but 5 people get into the same car accident, and then I'm gonna have 5 different reactions.
Yeah.
And so trauma is not the car accident itself. Trauma is the subjective experience of whatever the event is. For something like, for instance, depression. Depression is not sadness. Depression is not a low mood. Depression is a cluster of symptoms that must exist over a period of time in order for it to be considered depression. Anxiety is not just nervousness. It's not just fear. Anxiety is a cluster of symptoms that come together and significantly create dysfunction in a person's life. So these terms have been used so haphazardly that they're really taking away from the extent of what a person experiences when they actually experience these different diagnoses.
And to be clear, people can feel depressed on a particular day, feel low on a particular day. They might feel anxious about a particular thing, but that is very different to a clinical diagnosis of anxiety or depression.
Correct. And it's very different than somebody saying, I am depressed, right? I don't like that phrase to begin with. I always try to get my clients to say, I have depression. So it's something that you carry in the same way that it's something that eventually you can work against and move on from. But this idea of like, I'm feeling depressed versus I am or I have depression, very two different things.
And are people using them basically interchangeably?
Pretty much. And if something sad happens or something in their life that makes them feel sad or extremely low, all of a sudden I'm depressed or I have depression. Nope, that's not what that is.
And so, I mean, I mentioned there that we've said for a long time that, you know, the key to healthy relationships, healthy friendships, healthy family dynamics is that we need to communicate and discuss how we're feeling. Is there any sort of positive to take from this, or is that a completely different thing to the sort of psychobabble, I guess, that we're talking about here?
I think there's a lot of positivity from this idea that we're moving away from let's all, you know, have a stiff upper lip and nobody's talk about anything at all. And naturally, as with everything in life, the pendulum has to swing from one extreme to the other extreme. So I think we're at the other extreme where that's all we use is psychological conversations and psychological talks. At the same time, I think it's really taking away from what it actually is, and we're not really communicating. And this is coming from a psychologist. Please, Dubai, listen to me. Listen to me. Not everything is about feelings. It's okay to talk about things and not always talk about your feelings. And this is coming from a psychologist where feelings are a very important part of life, but it's not everything. And sometimes we drown in our own feelings and our own negativity because that's all what we're trying to do is we're trying to move into this extreme of we have to talk about our feelings all the No, we don't. We don't always have to.
Sometimes you can just be a bit cross one day and not talk about it for an hour.
Absolutely.
I want to get into some of the terms and what they actually mean next. I'm going to be getting Dr. T to give me the rundown on what some of those misused words actually mean in a clinical sense so that hopefully we can all use them correctly. We are discussing psychobabble on the show this afternoon. Social media has accelerated the spread of therapy speak. Hashtags like Therapy Talk have reached over 1.7 billion views. Hashtag Mental Health on Instagram's generated 49 million posts so far, showing how embedded these terms are in digital culture. And of course, we've long been told that there are benefits to communicating openly about how we're feeling, so that is healthy. But when does it go too far? At what point are we misusing complex psychological clinical terms to describe what are basic human behaviours or experiences? I'm joined in the studio right now by Dr. T, who has a very strong opinions on this, I would say. I think Dr. T's biggest ick we're discovering is people misusing therapy terms. And so before we go on to make sure that we are using them correctly, I want to run down, Dr. T, a few of the ones I've seen most commonly being, I guess, misused on social media. And I want you to tell me what they actually are and whether you see them being misused. So the first one is gaslighting.
Oh man, that one really hits hard for me because I think the world is really using gaslighting in such an incorrect way. They're using it as anybody who disagrees with me. So if you disagree with something that I'm saying and you tell me that what I'm saying is wrong, then you're gaslighting me. That's not what it is. Gaslighting is almost like the equivalent of bullying in a different way. So before, you know, when I was younger, there used to be like, if somebody picked on you the parents would like go crazy, be like, oh my God, they're being bullied. No, they're not being bullied. They got teased once. Bullying is repetitive. Gaslighting is the same. Gaslighting is not someone disagreeing with you. Gaslighting is someone repetitively and manipulatively trying to distort your reality in a way to make you feel like you're crazy. And they're doing everything in their power to get you to feel like what you're experiencing is unreal, is irrational, is irrelevant, and invalid. And so and that's consistent. It's not just a one-off. It's not a disagreement. It's not, I don't think, that's not what you said. That's not what gaslighting is. So I think this one is by far one of the most misused ones.
And is gaslighting something that is intentional on the other person's part? Would someone have to be sort of intentionally trying to repeatedly undermine you to be gaslighting you?
It's a tricky answer. I think for some individuals, it can be intentional. And for other individuals, it's very subconscious that they don't actually see that they're doing it.
But definitely it's not just, I don't agree with you and I think you're wrong to feel that way.
Correct.
What about toxic?
Yes, toxic is another one. Not used as often, I would say, with relationships. I think gaslighting is used quite often. Toxic is usually used to describe an environment. So toxic workplace, toxic boss, or a toxic group of people at work, things like that. So in some cases, toxic can be used a little bit more appropriately than other cases. So toxicity comes from this idea of like you are put in a situation that is not necessarily physically dangerous, but emotionally, mentally dangerous for yourself. And it is quite poisonous in one way or another. And it's creating significant harm to you. So that's what would be considered toxic. Again, it's not a one-off. It's not once in every year something bad happens. It's a consistent level of negativity coming your way that is significantly affecting you and the people that are around you and even your productivity at work. So that's what would constitute toxicity.
So it's someone who's always that way. It's not someone who snaps at you one day because they're having a bad day.
No, it's definitely not.
What about trauma? Because I feel that's one that gets misused a lot.
Right. Trauma is definitely misused, especially in different forms. So you have trauma and then you have trauma bonding and then you have the trauma reactions and there's so many derivatives of it. But trauma is actually the subjective experience of an event. So it's not the event itself. So let's say, for instance, like I mentioned before, the car crash. The car crash is not the trauma. It's how each person interpreted the trauma itself and what that created for them internally within their body and their nervous system and in their memories and so on and so forth. Now, a lot of individuals will use this term in a sense of like any hiccup or anything that happens to them, it's automatically a trauma. And I think, again, going back to this pendulum swing that we've had, where before we used to discard everything and invalidate and minimize everything.
Yeah.
Now we've gone to a place, and I hope we correct soon, where we overcorrected and we're like, everything is valid and everything. No, calm down. Not everything is everything. There has to be a space where we're like, okay, there's a bit of this that is just not a great day or not a great experience. And then there's some of this that comes from a place of not, you haven't built a really good resilience to life or a really good, reaction to or response to what happens to you. And then there is trauma. So there's a little bit of a lot of these different levels, let's say. And we have to be careful with the word trauma because we're kind of, instead of, going from nothing is traumatic to everything is traumatic is equally just as unhealthy.
And why is it so unhealthy? What does it do when we misuse these terms? Does it minimize their importance? Is it basically sort of the entirety of society becoming the boy who cried wolf? Is that where we're at?
I think a part of it is that, but I think another part of it is that it invalidates what people go through, what people who actually are experiencing a lot of these things, it invalidates what they go through. And it makes it so watered down that, like you said, people are crying wolf now. So if everybody's ex is a narcissist, Well, then that means half of this world is a narcissist. And the prevalence is actually much smaller than that. It's about almost to 6.2% of prevalence of narcissism. So it's impossible that everybody's ex is a narcissist. So I think we're just kind of, what we're doing is we're trying to create an understanding of the world that we live in. And before, we didn't have any terms. But now we have so many terms that are being misused in ways that they shouldn't be. And I think that's what's creating a lot of the difficulties in us truly understanding that actually it's not just a them problem, or it's not just an other person problem. It's one of the reasons why I have such a issue with one of the new books that have come out that everybody seems to be reading, which is Let Them. I have an issue with this book for so many reasons, because no, it's not just them. It's also you. You are equally responsible for the things that happen in your life. And this is important as an adult, not as a child, obviously, but as an adult, you're equally responsible. And so when we use these words of like, let them, it's a them problem. This sounds like a you problem. No, this is an us problem. We're forgetting that we are part of a community. There is no me and only me. We are part of a community. And so if something's happening between myself and someone else, it's because whatever they're experiencing and whatever I'm experiencing is not matching. And I'm part of that as well.
And I mean, we've mentioned boundaries a lot, and I think I wonder whether that's a part of it, that we've all been told now that it's very healthy to set boundaries. But I wonder whether we're just now applying them in a way that it's almost as though we're not able to have the difficult conversations.
Right.
It's kind of like, oh, well, I've got a boundary around that topic, so I'm just not going to engage.
100%. And I'm so glad that you brought that word up, because that's actually one of my favorite words is boundaries and boundary settings. But in reality, we, again, went from no boundaries to overcorrecting into building walls. So we're not actually building boundaries. We're building walls. For a lot of people, when they come to me and they say things like, oh, I finally set a boundary with X person, I did this. And I'm like, whoa, that's not a boundary. Because boundaries are based on mutual respect, respect for the other and respect for self. When you start getting to a place where you put yourself above somebody else, that is no longer a boundary. That is now me and me only. And that is why it's so important to be able to clarify what these words actually mean. So if I say, somebody invites me out for dinner and I say, look, I'm really sorry, I can't make it tonight. And even if you don't want to apologize, fine. I'm the type of person who likes to apologize when I feel like I need to apologize. And for me, my friends are very important. So if I say, I'm sorry, guys, I can't make it tonight. However, how about we do it on the weekend? Because I know you're asking me to go out because you value our friendship. This is me respecting them and respecting myself and the fact that I'm tired. But if my friends invite me out for dinner and I say no, and I just drop it there, that's not a boundary. That's a wall that I'm building, because I'm neither offering some form of not reconciliation, but an alternative to what was being asked, but I'm also not honoring the fact that they are putting an effort to see me. So all of these things need to be kept in mind when you're setting boundaries, is that the respect it goes both ways. It goes to myself and to others, not myself before others.
Joined by Dr. T in the studio this afternoon. I've had a question in about anxiety. Keep your questions coming. We'll be putting them to Dr. T after the news. 4001 on the text, 04871 5500 on WhatsApp. How often have you heard someone described as toxic recently? Have you heard anyone calling someone, probably their ex, a narcissist, or making references to gaslighting? It feels like everyone at the moment has at least a basic knowledge of psychological terms, but emerging research cautions that using those terms in the wrong way is actually eroding their meaning and even jeopardising our relationships. Now, I'm still joined in the studio by Dr. Thoraiya. And Dr. T, I wonder, how does it impact on our relationships with people when we misuse these terms and effectively sort of diagnose the behaviour of people around us when they don't necessarily agree with us?
Well, I mean, I think it can be quite damaging to any relationship, especially intimate relationships. You might hear these words a lot more commonly used. So you're gaslighting me, you're being toxic, or you're such a narcissist. You know, these types of things. They're quite critical and contemptful, to be honest, because you're attacking a person's character when you're speaking to somebody like that. However, and you're speaking to their intention, really. Friendships, I would say it's less common to have friends use these words other than gaslighting. Gaslighting, I think, would be very common amongst friends as well, but usually narcissistic or toxic, it's not as commonly used amongst friends. Still, I think when we get to a place where we have classified a person's behavior into a lump of a diagnosis or a label or a categorization, we've pretty much limited them into that space. And so now we start to see them as an individual who is that way. And what ends up happening with that is that we change our behavior. And so our behavioral change leads to them changing their behavior towards us. And so now we have like this self-fulfilling prophecy of how we're behaving towards somebody because we're assuming that we are competent enough to understand what the actual label is towards that person. And thus that changes our behavior. And so it can be extremely damaging, but also it can lead to us creating the scenario in which we are kind of, expecting it to be.
I read something this week that said if you think what you say in an argument doesn't matter, throw a plate on the floor and then apologise to it and see what happens. And I thought it's really true because the things that we say in arguments, they do stay with us. You can't just sort of apologise your way out of it. And it's one thing to say to someone, I don't like what you just said. But branding someone a narcissist is quite a move. I mean, narcissism is not just somebody being a bit mean to you sometimes.
No, it's no joke. Like narcissistic person, and it's actually not even narcissism. There's no such diagnosis as narcissism or narcissistic. It's narcissistic personality disorder, right? It's an actual diagnosis. And this diagnosis, again, comes with a cluster of symptoms. So it's not just a person who manipulates. It's not just a person who thinks highly of themselves. It's not just a person who, tries to hurt other people for their own gain. It's not. So all of these things that we use the word narcissistic about, it's not just this or that. It's not even 2 or 3 of those. It's a cluster of like 5 minimum symptoms in order for a person to have an actual narcissistic personality disorder. And as mentioned before, the statistics are only 6.2% of the human population are NPDs, which basically means that it cannot be as prevalent as everybody is saying. And to be honest, and I know this sounds quite harsh, but this is the reality. Not many people are qualified enough to make that diagnosis. And so, they'll say things like, oh, I read this article or I heard this podcast or I watched this movie. And I'm like, good for you. But there's about 12 years of experience or 12 years of learning and about 10 years minimum of experience for you to be good enough to be able to diagnose a personality disorder. Personality disorders are very tricky because every single person on this planet possesses personality traits. And the traits of borderline personality, narcissistic personality, what people use as psychopathic or antisocial personality, or even obsessive compulsive personality, everyone on this planet has a trait that falls under one of these diagnoses. However, not many people, and this is the truth, even amongst psychologists, I know a lot of psychologists who have misdiagnosed individuals with personality disorders because they don't have the qualifications to do so. So it takes a lot of years of studying and a lot of years of clinical experience to be able to properly diagnose somebody with a personality disorder. A narcissistic personality disorder is not an easy one because they hardly come to therapy unless they're forced to. So essentially, when we're talking about this haphazard usage of personality disordered phrases, or it's even borderline personality disorder, same thing. People will throw that word around. Oh my God, she's so borderline. Oh my God, he's so borderline, or, things like that. These are, again, they are actual clinical scientific terms that are being used as a way to shame and blame another person for behaving in a way that may not be great, for sure. At the time, though, you don't actually know all of the the variables that are around that situation. So it's just very easy for us to throw out these words as a way to categorize the world around us so we can make sense of it and put some form of like excuse or justification for that behavior.
And I mean, you mentioned there being qualified to sort of diagnose, and we've had a couple of questions come in, and one of them seems quite relevant to that. It's an anonymous message. It says, what would you advise the appropriate response would be for a parent to a teacher who says that a child has separation anxiety? I can see that that's a psychiatric term, but it feels as though it's being misused. Now, we were saying earlier about kind of pathologizing normal behavior. I feel like lots of children struggle at drop-off, particularly when they're younger. Some days, there are days where kids don't want to leave their parents.
Yeah, and they don't sleep well, they didn't eat well, whatever it is, they're feeling sick. And so they want more of that secure attachment with their primary caregiver, for sure.
So where's the line between that and separation anxiety then? And would a teacher be qualified to say this child has separation anxiety?
Absolutely not. A teacher would not be qualified. Not even a student counselor would be qualified to make that diagnosis. So as a separation anxiety disorder has to be diagnosed by a clinical psychologist, an educational psychologist, a school psychologist, or a psychiatrist. Those are the only four actual professions, off the top of my head really quickly. Yes, those are the only four that can actually diagnose something like that. School counselors, teachers, even like the principal, they do not have the competence nor the scope of practice to be able to diagnose something like that. However, I understand that their academic experience gives them a lot of insight into behavior of children. And absolutely, I'm not going to take away from that. However, to be able to diagnose something like that, no, they cannot do that. They're not actually allowed. It's illegal for them to, and unethical for them to throw a diagnosis. They can say to the parent that, look, I've noticed that the separation that happens between you and your child is concerning for me. So how about you take your child to, get either assessed or look into getting them some help. Sure, that's a great way to have that conversation. What's not okay is for the teacher to actually say, your child has separation anxiety disorder.
And so if they talk about separation anxiety, then your advice to that parent then would be, well, they might feel anxious today, but I'll take them to a professional if I want to find out if they have, quote unquote.
Sure, that's the really nice way to say it, Jen. Thank you.
Trying to be diplomatic, Dr. T. Another question about anxiety actually here on the message is saying, I associate a lot of overthinking with anxiety, but I'm wondering whether I'm using anxiety correctly. Is overthinking a predecessor to anxiety, or is overthinking meaning that I have anxiety?
It's actually a catch-22 when it comes to anxiety and overthinking. Now, to be 100% clear, generalized anxiety disorder or any type of anxiety disorder can only be classified as a disorder if it, and as the name says, creates disruption in the order of your life in at least two significant areas, right? So if I'm having a bit of anxiousness today, nervousness today, that's not anxiety, right? Anxiety is basically that I am living with a sense of dread and overthinking and constant worry, and I can't control these thoughts. And these thoughts and this worry and all of that is influencing and negatively affecting at least two areas of my life in a way that's disrupting my life. That's where the word disorder comes from. It's a disruption in the order of two areas of your life. However, overthinking does exacerbate anxiety, but also anxiety exacerbates overthinking. So they're very much connected. It does not necessarily mean that you might have the diagnosis of generalized anxiety disorder, because overthinking and even anxiety symptoms are very much also connected to obsessive compulsive disorder. It's also very much connected to so many other types of disorders. So that's why it's so important to get a diagnosis, if you want a diagnosis, to get a diagnosis from either a clinical psychologist or a psychiatrist. Those are the only two people or the two professions that are actually licensed and understand the level of diagnosing. Now, some areas and some places around the world have counseling psychologists that can do the same, but more often than not, you have clinical psychologists and psychiatrists that are the only two that are allowed to assess and diagnose individuals because of their training. So it's very important to make sure, because unfortunately what happens is a lot of therapists, a lot of psychotherapists, a lot of psychologists, in order to keep clients or have clients, they will throw these terms out, and these terms are being misused, even amongst the profession. Like, let's be clear, our profession is not perfect either. There are a lot of psychologists, a lot of psychotherapists that also take advantage of the vulnerability of a lot of clients. So be careful and make sure that you are checking for your psychologists or psychiatrists or therapists credentials, their certifications, what's their specialties and things like that before you visit them, so that you truly know that you're getting the help that you need and the help that you deserve.
Absolutely. And I've got less than a minute left with you, I guess. Final word then, for people who do think that maybe they are expressing themselves more clearly by saying, I feel like that is a toxic behaviour, or I feel like I am just exerting a boundary. What's your message to those people who might be misusing terms, not to do harm, but just because they are trying to express themselves?
Well, what I would say is that the narrative that you use in your life is the narrative you live by. So be careful with the words that you use. Even if you're joking, even if you're messing about, it doesn't matter. When you say things like this person is toxic, your brain learns to create an association with this person equals toxicity, which means when you're around that person, you're going to feel a sense of discomfort and you're going to see things from a negative light. So your narrative is going to very much influence how you see the world. So be very, very careful.
Dr. T, always a pleasure. You've been listening to Dr. Thoraiya. She is from the Human Relations Institute. And if you had any other questions we didn't get to, or if you want to get in touch with Dr. Thoraiya, send me the word therapy. I will send you her info.